Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to start is called prevention in general practice. I'm sure you guys must have heard about prevention in medicine and prevention of the diseases. What does prevention really mean and what are the types of prevention? So there is a saying by Louis Pasteur in 1884. When meditating over a disease, I never think of finding a remedy for it, but instead a means of preventing it. So as you guys know that prevention is always better than cure. So that is what prevention means in general practice. Prevention may be defined as the means of promoting and maintaining health or averting illness. It is concerned with removal or reduction of risks, early diagnosis, early treatment, limitation of complications, including those of iatrogenic origin, and maximum adaptation to disability. So there are basically three kinds of prevention or three types of prevention. Number one is primary prevention, secondary prevention, and tertiary prevention. What is primary prevention? So basically, primary prevention includes action taken to avert the occurrence of disease. As a result, there is no disease. So in primary prevention, we try that there is no happening of like the disease shouldn't happen in the first place. So what are the primary preventative strategies or examples? So education to bring changes in lifestyle factors, like for example, smoking cessation, healthy balanced diets, reduction in alcohol intake, exercise, diet, and all of that. So exercise, diet, smoking, alcohol, all of that kind of education stuff in lifestyle modification. Then sterilization of surgical instruments and other medical equipment while doing procedures to prevent any sort of infections. Then we have got eradication as with vector control of mosquitoes to control malaria, to prevent actually malaria. Immunization against infective diseases. Then sanitation, keeping our water supplies clean, and then disposing effectively of sewage and industrial wastes. So these are all the measures taken to prevent diseases from happening. I again would like to repeat that so that we can grasp it again. So primary prevention means strategies to help prevent the diseases from happening. So for example, when we talk about lifestyle factors, diet, exercise, smoking cessation, reduction in alcohol and exercise and all. So it means preventing diseases like obesity, like hypertension, like different after effects of let's say smoking, and then prevention of fatty liver, prevention of high cholesterol, prevention of high sugars, and all those kind of stuff from preventing it from happening. Okay. Then number two is sterilizing. Like for example, we sterilize all our surgical equipments when we go and do any surgical procedures, so as we do not infect the patients. Then we have got immunization. Immunization is the biggest example. Like for example, all the vaccines that we give to our kids, all the immunization that we give to adults, like for example, COVID-19, influenza, shingles, all those kind of vaccinations that we do to help and prevent the diseases from happening. So that is primary prevention. Number two is secondary prevention. Secondary prevention includes actions taken to stop or delay the progression of disease. So a disease has already happened, but we try and detect it at early stages so that we can stop the disease from progressing. This is what is the most important that applies in general practice, and I would be talking to you in detail about it because it's very important for you guys to know about it. And this actually includes all the screening tests, like say let's for example screening for colon cancer, screening for cervical cancer, screening for breast cancer, all these kind of cancer screenings basically. Or let's say if we monitor height, weight and BMI, so screening for obesity. So all these kind of screening measures in which the disease is at very early steps and we try and detect it, so as like for example, if some cancers that are detected at early stage, we can get rid of them completely. Or diseases that are detected at an early stage, they can be stopped from progressing so that it doesn't progress and doesn't grieve you more. Then comes tertiary prevention. Tertiary prevention includes the management of established disease so as to minimize disability. So see how beautiful it is. We are talking still about prevention, but even the management and the medication and the medical management of a condition also comes as prevention, and it's called tertiary prevention. So for example, if you have high cholesterol, right, and we try and medicate you for high cholesterol, it means what are we preventing? We are trying to prevent fatty liver. We are trying to prevent coronary heart disease or heart attack. We are trying to prevent stroke. All the things that are consequence of high cholesterol. So that is also tertiary prevention. So that is of course, that is medication, that is management of that medical condition, but that is also tertiary prevention. What is it preventing? It is medicating your high cholesterol or your high blood pressure or your high sugars, but it is preventing stroke. It is preventing heart attack. It is preventing fatty liver. It is preventing the other consequences. It is preventing sleep apnea. So see how beautiful it is, how beautiful the world of medicine is. So primary prevention means stopping it from happening. Secondary prevention, detecting it at a very early stage and stopping it from spreading or becoming a real problem. And third prevention is that where the diagnosis is already established and we are medicating it, we are managing it from other complications to happen. So these are three types of prevention. And tomorrow when I'll talk to you, I would like to talk to you about secondary prevention, which is the screening program. As an adult, you should know when you go to your GP that what are the screening programs at what ages that your GP should be offering you. As I said, that GPs are usually very, very busy. And when trying to give you holistic approach or holistic care, they can forget a few things here and there. But if you know that what at your age, what screening should be done. So here I'm not only talking about cancer screening. Here I'm talking about how frequently should your BP be monitored, how frequently your weight and height should be monitored, how frequently you should have your heart checked and stuff like that. So we'll talk more about it later. Have a good night.